I'm Dr. Laura Schummers. I'm an assistant professor in the Faculty of Pharmaceutical Sciences at the University of British Columbia. My research aims to improve reproductive population health through evaluating changes to policy and practice affecting reproductive health, access, and outcomes. So in April of 2023, British Columbia introduced a landmark policy for in the Canadian health landscape, making all prescription contraception free for provincially insured residents. Now, this policy really marked the end of about a decade of collaboration and partnership between academic researchers, health policymakers, health system leaders, and patient voices, patient advocates. And I was really privileged to join this maybe midway through. And so this work was ongoing already with some discussion of what it would take to really implement this policy. And I really enjoyed learning from and being part of conversations to understand what the implications would be within the health system, within the policy landscape, and how to sort of align the priorities to make this change happen. So over the course of several years, we engaged in meetings and discussions about what would be the impact, what is the need for this? Why are we considering this policy? And how might this policy change reproductive health outcomes and outcomes beyond health? So in a close partnership, we designed a dashboard and an evaluation framework. And then bringing the academic lens in, I prepared a grant with a national team of clinicians and health policymakers and researchers from a number of provinces to implement this as an academic question. So we sought to use what are called quasi-experimental methods to really estimate the effect of this policy on first contraception use, then on contraception access, and then measure what happens to pregnancies. Do we see a decrease in pregnancy rates and abortion rates? And then in the long term, what happens to health system costs? So do we save money as a health system when we provide access to contraception? Because of the really broad effects of unintended pregnancy societally, improving access to family planning services is an essential component of reproductive justice. So reproductive justice is really about equipping individuals with access to reproductive services so that they can control their own reproduction. They can decide when or if to become pregnant. So from that perspective, reproductive justice and equity, diversity, and inclusion are core principles of the research program that I lead and are the core outcomes that I hope to impact over the course of my career. I think so often academic output can just remain in the ivory tower. And we publish these academic papers and they sit on a library shelf and sometimes are read by the niche experts in our field. And that may be useful for moving science forward and building an evidence base. But it doesn't always really impact the people who pay for research through our tax dollars and who need an improved evidence base to support their healthcare and to support their public policies. So to me, bringing patients into my research program, partnering directly with policymakers, clinicians, health system leaders that have expertise that I don't, is essential to make sure that I'm asking the right question. It needs to start from the beginning of a research project and continue throughout the implementation and the interpretation of findings so that I don't just have my research sit on a shelf, but it can actually be used out in the world to improve reproductive population health. Because if we're not putting these findings in the hands of clinicians, leaders, and patients, it's not doing its job. In addition, I'm so delighted to see reproductive health and contraception and abortion access highlighted right now, where in the global political climate that we're in the middle of, it's essential for Canada to remain a leader. And having an award that is focused on contraception and on abortion access in the Canadian context means that our institutions, our government partners, we still value reproductive health and justice, even when other settings might be eroding reproductive rights and access.